1 in 4 Medicare patients, that's millions of seniors, get at least one useless medical test every year. And those unnecessary checkups swallow roughly $100 billion of our healthcare dollars.
Meanwhile, the screenings that actually keep us living stronger, longer, often slip through the cracks.
Welcome to Best Life Senior Podcast. I'm Joseph Barnes, and with me is geriatric specialist Dr. William Franklin.
Thanks, Joe. Today, we'll help you ditch the 5 checkups that waste time and money and spotlight the few that truly matter.
Will, let's start with the heart. Many seniors book an annual treadmill stress test even when they feel fine. Worth it?
Not for most. If you have no chest pain, no shortness of breath, and you can climb a couple flights of stairs without trouble, the U.S. Preventive Services Task Force actually advises against routine stress or resting ECGs. They found more harm than help for low-risk adults.
Harm? That machine just tracks your heartbeat while you walk. Where's the danger?
False alarms. In people with low risk, a positive treadmill test is often wrong. One family medicine review calls the yield extremely low and notes the snowball effect, extra scans, dye injections, even unnecessary stents.
So a blip on the screen can send you on a medical merry-go-round.
Exactly. More pokes, more dyes, more bills, more worry, and no proven boost in life expectancy.
Let's drop in a real-world picture. Imagine Mrs. Carter, 76, gardening 3 hours a week. Her stress test lit up positive. 2 days later, she's in a cath lab, dye racing through her arteries, only to learn her vessels are clear. That one false lead cost her a sleepless week and $3,000 out of pocket.
And nationwide, $500 million each year on stress tests that guidelines say to skip for symptom-free folks. That money could cover flu shots for every senior twice over.
Big price tag, tiny payoff. So, what matters instead?
3 simple moves. First, keep tabs on blood pressure. It predicts heart events far better than a treadmill printout. Second, walk daily and note how you feel. Shortness of breath at your normal pace is a real red flag. Third, talk to your clinician about cholesterol and diabetes control. Those basics cut risk by double-digit percentages.
No fancy machine needed. Just a cuff, a pair of shoes, and an honest chat with your doctor.
Right? And if you do have new chest pain, that's when a stress test shines. The test should answer a question, not create one.
Quick recap before we roll forward. If you're symptom-free, the yearly stress test wastes time, cash, and calm. Swap it for smarter basics. Pressure checks, daily movement, and lab work that guides real treatment. Clear?
Crystal. And ditching that one test frees up both clinic slots and your own schedule for the stuff that makes life rich, like more mornings in the garden.
Will. Next on the list is the PSA blood test for prostate cancer. Lots of men past 70 still get it every single year. Smart move or no?
No. The U.S. Preventive Services Task Force is clear. Men aged 70 and older should skip routine PSA screening. The downsides now outweigh any upside.
Downsides? It's just one little vial of blood.
The stick is easy. What follows can be hard. About 70% of high PSA readings turn out to be false alarms. One bad number can drag you through biopsies, scans, and even surgery you never needed.
Painful and pricey, I bet.
Very. Medicare shelled out roughly $447 million in a single year just on PSA screening and its domino tests. Another analysis put the 3-year tab at $1.2 billion for men who gain almost no extra life from the whole ordeal.
Money that could buy hearing aids or fix sidewalks, anything but wasted tests.
And the human cost is real. Biopsy needles can cause bleeding or infection. Follow-up treatments risk incontinence or intimacy problems, all for cancers so slow they might never cause trouble.
Let's ground this. Picture Mr. Diaz, 78, still bowling twice a week. Routine PSA comes back high. 2 weeks later, he's flat on an exam table for a biopsy. No cancer found, but he leaves sore, anxious, and a few $100s lighter.
Multiply Mr. Diaz by millions. The CDC warns older men face more false positive PSAs, which fuels overtreatment and stress.
So what should seniors do instead?
Start with symptoms, not scores. New urinary trouble, bone pain, or sudden weight loss. That's worth a real talk. Share family history too. An aggressive cancer in a brother before 60 changes the risk math. Then double down on basics: daily movement, balanced eating, and tight control of blood pressure and diabetes. Those habits cut many cancer risks at once.
And if you're a remarkably healthy 70-year-old with decades ahead, you can discuss PSA with your doctor, right?
Absolutely. Shared decisions matter, but blanket yearly testing? Skip it.
Quick takeaway. Routine PSA tests after 70 spark false alarms, big bills, and needless worry. Save the vein poke for when real symptoms show up.
Your later years should focus on grandkids and weekend hikes, not waiting rooms.
Love that. 3 more overrated checkups to bust. Ready?
Let's roll.
Will, number 3, hits close to home for a lot of listeners. The just-in-case colonoscopy after the mid-70s birthday. Is that yearly scope still a must-do?
Not anymore. The U.S. Preventive Services Task Force says once you pass 76, blanket screening offers only a small net benefit, and after 85, the math flips hard toward risk.
Small benefit sounds polite. What does risk look like in real numbers?
For adults over 80, serious complications jump to roughly 35 per 1,000 colonoscopies. Things like bleeding, perforation, and heart-lung trouble during sedation. That's about a 1/3 higher risk than folks in their late 60s.
1 in 30? That's a full busload of grandmas and grandpas facing trouble every day just from the procedure.
Exactly. And guideline groups like the American Cancer Society flat out advise stopping routine screening at 85. Even 76 to 85 should be a maybe let's talk zone, not an automatic booking.
Yet calendars still fill up. Medicare covers it, so clinics keep calling, and seniors don't want to miss the test that saves lives.
Coverage isn't the same as benefit. Colonoscopies do save lives earlier on, but once you reach an age where other health issues are more likely to shorten life first, the payoff shrinks. Meanwhile, a perforation can land you in the ICU tomorrow.
Paint us a picture.
Meet Ms. Lee, 82. She's sharp, active, bakes for the church fair. Her 10th year reminder letter arrives. She schedules the scope. Prep day steals 24 hours. During the exam, a tiny tear occurs. She spends 3 nights in the hospital and misses her granddaughter's recital. Pathology finds 0 cancer. Net gain? None. Net loss? Real.
Ouch, literally and figuratively. And there's a money angle too, right?
Medicare Part B still pays the facility and physician fees, usually a few $100s each. But if a polyp is snipped, it turns diagnostic, and coinsurance kicks in. Add ambulance or surgical bills after a complication, and costs balloon. Seniors with fixed incomes shoulder that risk more than they think.
So if the scope isn't routine past a certain age, what's the smarter play?
3 steps. First, focus on red flag symptoms: new bleeding, unexplained weight loss, bowel changes. Those do warrant a workup, sometimes still a colonoscopy. Second, switch to non-invasive stool tests like FIT or stool DNA. They're quick, home-based, and carry 0 perforation risk. A positive result can trigger a targeted scope. Third, eat fiber-rich foods. Keep moving and stay smoke-free. Lifestyle trumps late-life screenings.
So the big message, after about 75, colonoscopies move from automatic to optional, and after 85 to almost never, unless symptoms raise a red flag.
Right? Let's spend our 80s dancing at weddings, not counting ceiling tiles in recovery bays.
Our fourth overrated checkup is the vitamin D blood test. Seems harmless. Just squeeze an extra tube during your regular panel. But do symptom-free seniors actually need it every year?
In nearly all cases, no. The U.S. Preventive Services Task Force says the evidence is insufficient to show any health benefit from routine screening in adults without symptoms.
Yet clinics push it hard. What's the scale of this craze?
Medicare alone shelled out about $337 million on vitamin D tests for older adults in a single year. Up to 3/4 of those orders fit an over-testing pattern, meaning no risk factors, no symptoms, just habit.
$300 million for a line on a lab slip. And what does that number buy us?
Not stronger bones or fewer falls. The latest USPSTF draft found that supplementing vitamin D, when levels weren't low to begin with, does not cut fracture or fall risk, and it may boost kidney stone odds.
So the test often leads to pills that don't help and might hurt. Any emotional toll here?
Plenty. A low result can brand someone as fragile when they're fine, driving anxiety and extra doctor visits. Meanwhile, people with borderline high readings start fearing toxicity. It's health theater, not health care.
Let's meet Mr. Alvarez, 79, plays doubles tennis twice a week. His annual panel flags a vitamin D of 28, just shy of the arbitrary 30 nanogram cutoff. He walks out with megadose capsules, a repeat test order, and a $40 copay. 3 months later, repeat labs show 32. Mission accomplished? Maybe. But nothing in his life changed except the pills and the bill.
Multiply Mr. Alvarez by a few million, and you see why Australia spent about $105 million and the UK about $17 million yearly on largely unnecessary tests.
What should seniors do instead of chasing a number?
3 common sense moves. Get safe sunlight. 10 minutes in arms and face most days usually suffices. Eat D-rich foods. Fatty fish, fortified milk, egg yolks. Consider a modest over-the-counter supplement. 400-800 IU daily, only if your clinician spots a genuine risk factor. Osteoporosis, long-term steroids, male absorption.
No fasting, no phlebotomy chair, no surprise copay.
Exactly. And if you do develop bone pain, muscle weakness, or have a disease that interferes with absorption, that's the time for a targeted vitamin D check. A test should solve a problem, not look for one.
Quick recap. Routine vitamin D. Screening drains wallets, fuels pill bottles, and rarely changes outcomes. Swap it for sun, salmon, and smarter conversations.
Let's spend that lab money on a park pass and a picnic instead.
Last on today's hit list, the just to be safe urine test. A quick cup in the clinic, harmless, right?
Seems harmless. But if you don't have burning, urgency, or pain, routine urinalysis does more harm than good. The U.S. Preventive Services Task Force gives it a flat D grade, don't do it, for symptom-free adults.
A failing grade. Yet half the folks in my mom's retirement community get one every physical.
Not surprising. Up to 50% of nursing home residents carry bacteria in their bladder every single day with 0 symptoms. The test lights up positive, and everyone panics.
So the lab says infection, but the body says I feel fine.
Exactly. We call it asymptomatic bacteriuria. Treating it with antibiotics doesn't add a single healthy day. Yet, it invites side effects, rashes, gut trouble, even C. difficile diarrhea. USPSTF reviewers list those harms loud and clear.
And resistance, right? Another unnecessary script means tougher bugs next time.
Bingo. Multiply that by millions. Americans spent roughly $8.5 billion a year on urine testing during the last decade's peak. Seniors shoulder a big slice of that, and Medicare ends up funding pills no one needed.
Let's frame it. Picture Mrs. Brown, 81, sharp as a tack. Routine urine dip shows bacteria. She leaves with a 10-day antibiotic. Day 7, severe diarrhea. EMS ride, hospital stay, IV fluids, scared family. All because of a test she never needed.
Sadly common. One study pegged inappropriate urine cultures as a major driver of hospitalizations for drug reactions in long-term care residents.
Okay, how should listeners handle urine worries?
3 quick cues. First, listen to your body, not the calendar. Pain, burning, fever, or new confusion can signal a real urinary infection. Second, stay hydrated and keep pelvic muscles active. Walking to the mailbox helps bladder emptying. Third, if a doctor suggests a just-in-case urine test, ask, "Do I need this without symptoms?" Shared decision, not automatic.
Simple, empowering, no symptom, no sample.
Right. And if symptoms strike, fine, test away. Then antibiotics target an actual problem, not a phantom one.
Quick recap. Routine urine tests in healthy seniors uncover harmless bacteria. Spark, needless antibiotics, fuel resistance, and cost billions. Skip the cup unless your body raises a red flag.
Save that clinic time for something better, like planning the next family reunion.
All right, Will, time to reveal the first do not miss check-in, blood pressure tracking. Sounds almost too simple, but why does this one top the list?
Because high blood pressure is a silent wrecking ball. It hides for years, yet it fuels half of all strokes and heart attacks. The USPSTF gives blood pressure screening its highest grade A rating. Start at 18, repeat every visit, and for folks over 40, check at least once a year.
Grade A, top of the class. What does catching it early actually buy us?
Huge dividends. Drop systolic pressure just 10 points, and you slash stroke risk by roughly 40%, even in people over 80. That's the difference between spending Tuesday at bingo or in a rehab ward relearning how to button a shirt.
40% is life-changing. Yet pharmacies still see seniors grabbing cough drops but skipping the free cuff station. Why?
3 reasons. First, hypertension feels like nothing. No pain, no rash, so it's easy to ignore. Second, clinic cuffs can spook people. They hear white coat and think readings won't count. Third, the myth that a little high is normal in old age. Truth, arteries don't retire. They stiffen and need even more care.
So how do we make tracking painless?
I teach the rule of zeros. 0 cost. Use the grocery store kiosk or a $30 home monitor, both accurate if the cuff fits. 0 excuses. Check one arm, reading after breakfast twice a week. Log it in a notebook or phone. 0 surprises. Bring that log to your clinician. Treatment tweaks come from patterns, not one-off spikes.
Love the rhyme. It sticks. And if numbers hover above 130/80 more than once?
Time for a game plan. Daily walks, less salt from processed foods, and if needed, low-dose meds. Modern pills often cost pennies and have decades of safety data.
Any downside to this check-in?
Virtually none. A cuff squeeze might pinch for 5 seconds. Compare that to stroke rehab at $17,000 a month. Early control is the cheapest insurance a senior can buy.
Let's humanize it. Picture Mr. Jenkins, 74. He grabs a pressure reading while waiting for his prescription, 150/92. The pharmacist suggests a second try next week. Same result. Fast forward 3 months. He's 10 pounds lighter, takes 1 pill at breakfast, and his numbers sit at 125/78. He feels 0 side effects, but just cut his stroke odds nearly in half.
Multiply Mr. Jenkins by 10 million, and you'd empty entire stroke wards.
Recap. Blood pressure isn't just another vital sign. It's the steering wheel for your brain and heart. Check it, track it, tame it, because small cuffs prevent big catastrophes.
And it costs less than a burger combo.
Will, the second must-do check-in is the bone density scan, DEXA. People think it's optional, but why should seniors circle it in ink?
Because brittle bones snap lives in half. The USPSTF says every woman, 65 and older should get a DEXA, and many men 70 and up benefit too. That's a solid grade B recommendation. Clear evidence it lowers fracture risk.
Lower risk how much?
A pooled study of more than 50,000 seniors found that screening plus timely treatment cut hip fractures by about 25% in high-risk groups.
25% fewer broken hips means 25% fewer emergency calls, surgeries, and rehab beds. What's the price tag when a hip does break?
Big. U.S. hospitals manage roughly 150,000 hip fractures a year, costing $10 to $15 billion. Add lost independence, and you see why some analysts peg the wider burden at $17 billion annually.
And recovery isn't just money, it's mobility, mood, even life expectancy.
Exactly. 1 in 3 seniors never walks unaided again after a hip fracture. Yet the DEXA itself is a 10-minute lie-still scan with radiation lower than a cross-country flight.
So what stops folks from booking it?
3 myths. First, I take calcium, so I'm safe. Bones need more than calcium. They need strength training and, when warranted, medication. Second, only tiny women break hips. Reality, men over 70 face rising risk, especially if thin, a smoker, or on steroids. Third, it's pricey. Medicare covers it once every 2 years for eligible patients. Out of pocket is often zero.
Give us a human story.
Mrs. Johnson, 66, active gardener, healthy weight. Her first DEXA flagged osteopenia, bone just starting to thin. She began simple weight-bearing exercise and a weekly generic pill costing less than a newspaper. 2 years later, her repeat scan held steady. That likely spared her a hip pin and a stretcher ride.
And men?
Mr. Patel, 71, never smoked but used prednisone for asthma. His DEXA revealed osteoporosis. He started a monthly injection, boosted protein intake, and signed up for Tai Chi. His spine T-score improved, and he hasn't shrunk an inch.
Practical steps?
First, ask your clinician if you fit the screening window. Women 65 plus, men 70 plus or younger, with risk factors like long-term steroids. Second, schedule the scan. It's quick, clothing stays on, no tunnel or noise. Third, act on the result. Weight training, vitamin D, maybe medication that's been shown to cut fractures by up to 50%.
Recap. Brittle bones are silent until they shatter, but a fast, painless scan spots weakness early. That scan plus smart follow-up can save billions. And more important, save your stride.
Strong bones keep you dancing at weddings instead of watching from a wheelchair.
And our third must-miss at your peril check-in is the comprehensive dilated eye exam. Sounds routine, but paint the stakes for us, Will.
By 65, 1 in 3 Americans is living with an eye disease that can steal sight. Glaucoma, macular degeneration, diabetic retinopathy. None announce themselves early. A yearly dilated exam is the single sure way to spot them, while vision is still perfect.
Losing vision isn't just about driving privileges. It flips life upside down. What does blindness cost in hard dollars?
A Prevent Blindness report put the national price tag at roughly $35 billion a year, and that was 2 decades ago. Factor in inflation and assisted living bills, and the meter keeps spinning.
Yet many seniors skip the exam because they see fine.
That's the trap. Early glaucoma steals peripheral vision molecule by molecule. By the time a patient notices, up to 40% of optic nerve fibers may already be gone. The damage is permanent, but a 10-minute dilated exam could have frozen the disease in its tracks with 1 daily drop.
Give us a human snapshot.
Mrs. Clark, 73, still leads the choir. She skipped eye checks for 7 years because her reading glasses worked. A faint shadow finally nudged her to the clinic. Advanced glaucoma. Her left eye never recovered full field. If she'd come 2 years sooner, drops at $20 a month would likely have preserved perfect sight.
And vision loss links to falls, right?
Absolutely. Poor eyesight triples fall risk. The American Optometric Association ties comprehensive eye exams directly to fall prevention in adults 65 and up. A broken hip can run $15,000 and cut independence in half. Compared with that, an eye exam is pocket change.
Any reason to fear the test itself?
None. A few eye drops widen the pupil. Lights, lenses, done. Radiation is zero. Needles, zero. Cost often zero because Medicare Part B covers annual dilated exams for diabetics and people at risk of glaucoma. Many vision plans extend coverage to everyone over 65.
What if a listener can't get to an ophthalmologist easily?
Ask for a mobile vision van. Many nonprofits send them to senior centers. At minimum, set a reminder during primary care visits. Most clinics now partner with local eye specialists for same-day slots.
Translating all that. See the eye doctor before you feel a problem. Early detection means eye drops, maybe a simple laser, instead of vision rehab classes.
Exactly. Eyes are windows to the world and to the brain. Untreated eye disease accelerates cognitive decline, social isolation, even depression. One painless visit keeps those windows clear.
Recap in a sentence. Schedule a yearly dilated eye exam after 65. Earlier if diabetes or family history looms, because catching trouble early preserves sight, independence, and wallets.
And it keeps the view sharp for the grandkids' graduation.
Will, we've shown how to skip 5 money-draining checkups and lock in 3 life-saving ones. But how does a listener actually push back when a well-meaning doctor orders a test the guidelines say to skip?
Arm yourself with 5 short questions. They come from the National Choosing Wisely campaign and fit on a wallet card.
5 questions. Hit me.
First, do I really need this test? Ask what problem it will solve today. Second, what are the risks or side effects? Even a blood draw can chase you into more scans. Third, are there simpler, safer options? Often, lifestyle tweaks or a wait-and-see visit work better. Fourth, what happens if I do nothing? Many results don't change life expectancy at all. Fifth, how much will it cost? A number on a lab slip can snowball into 4-figure bills. These 5 lines turn a polite nod into a real conversation, and most clinicians welcome it.
So the script is, look the doctor in the eye, ask those 5, and let the answers guide the next step. Test, tweak, or toss.
Exactly. If the test won't change treatment, skip it. If it might catch a time bomb early, like our blood pressure check, book it.
Listeners, copy those questions on a sticky note for your next appointment. They could save you cash, stress, and even a hospital stay.
But we're not closing the chart just yet. In our next episode, we uncover 3 everyday habits quietly stealing seniors' brain power while they sleep. And none of them involve crossword puzzles or caffeine. The first one happens before you even brush your teeth.
Change those habits, and you might sharpen memory faster than any supplement on the shelf.
Curious? Good. Because that story starts the moment you hit play on the next show.